Good evening, Commonwealth, and thanks for watching the Channel 2 News. I'm Ashley McDowell. Let's take a look at tonight's top stories. Drive-thru testing for COVID-19 is scheduled to begin in the CNMI. Also tonight, CHCC unveiled the completion of the medical care and treatment site. And more supplies for COVID-19 response have arrived in the CNMI. Stay with us. These stories and more are next.
My family is on whole home Wi-Fi powered by Plume.
Since we installed the Docomo whole home Wi-Fi, what did you guys notice about it?
When you pull up the driveway, it automatically connects, and I don't have to get out of my car right away and come upstairs to go on my phone.
My favorite thing is that it doesn't buffer when I'm watching YouTube.
My favorite thing is that when Addie calls now, there's no lag. Like before, it used to be where I couldn't see her sometimes and I have to hang up and then call her back, and now I don't have to do that.
You know what's a good thing too is that when you come over to visit, I could give you your own password. I can assign a time limit so that I can say that you can only be on it for 1 hour, so that means you won't get in trouble from your mom.
And then you can go home.
The thing that I love the most is that I can freeze the internet for periods of time so that we can enjoy dinner time like this. Why are you rolling your eyes? So I'll turn it back on after dinner.
Whole home Wi-Fi powered by Plume. Docomo Pacific, better together.
Hafa Day, Tirwami, and good evening, Commonwealth. Today is Monday, April 27th, 2020. Those who want to be tested for COVID-19 here in the CNMI now have that option. Here are the details. It's called Community-Based COVID-19 Drive-thru Testing, a way of providing free COVID-19 testing to those who are interested.
When we do the testing, because of the priorities, it's always about symptomatic, right? And so having the ability to do the community-based testing is critical, because you're looking at individuals that are asymptomatic and not coming to the facility for healthcare services. So the governor, this is his initiative, to make sure that the testing is available for those that want to be tested.
Where starting tomorrow, April 28th, those who have registered will be able to drive up to the COVID-19 testing site located at the Saipan International Airport, stay in your vehicle, and get tested for the coronavirus.
They did the first responders today, again through a registration program. You register in and you go and get tested. We should be starting that tomorrow again and throughout the week. I just ask our community for your continued support and patience. I'm sure that we can, through your patience and collaboration, that this process will go through. I know that the CHCC, the task force, their priorities and ours, myself as well, is to maximize your participation in going to get tested and as seamless as possible. So just be patient on the process, and I know that it's a learning process. We've never done this before, but I know that their intention is to get everybody tested.
Munoz says there is a system for those who are interested in getting tested.
You have to register. You have to have an ID, a photo ID, the best. It doesn't have to be current. It can be an expired ID. We don't really care. We just want to know that this is you and you want to be tested. So we're not, it's open to anyone. It's free. Just register, show up, and we'll get back to you with your results.
The drive-through testing will be limited to 4 people per vehicle, with results given in a reasonable time frame, according to CHCC.
It's limited to 4 in a car. The reason for that is because, as you know, we're dealing with body fluids, so we want to make sure that, for those on the right, we will front and back, we will test them. We have 4 nurses, two to 4 nurses are going to be on both sides. We don't want any middle seat, again, because of that body fluid. So again, it's limited. You need to register. Once we have that, we'll call you. You'll receive a call back with a number. That number is your identification number that we will basically look you up in there.
Munoz says the test is performed through a nasal swab using the Diaplex-Q PCR novel coronavirus detection kit from Seoul in South Korea. She says they are looking into antibody testing as well.
We are also looking at antibody testing eventually, but that is not, we're waiting for that. Obviously, as soon as the EUAs were issued, the emergency use authorization was issued, there's, the supply is always an issue of supply. So we are going to be working on that to get the antibody testing as well, for those that have been immune or have been exposed before.
According to Munya, Rhoda and Tinian will also be set up with a drive-through testing site.
We will also be going to Rhoda and Tinian. We will be setting them up as well so that we can make sure that they have the VTMs, the viral transport media, so that they can. We also need to make sure that once they collect it, they put it at the right temperature and send it over to us so that we can do the testing.
April 17th was the last confirmed positive case of COVID-19 in the CNMI. As of today, April 27th, there have been 14 confirmed COVID-19 cases, 11 recovered cases, 2 deaths, and 249 individuals released from quarantine in the CNMI. For those interested in registering for the drive-through COVID-19 testing, a request can be submitted online by the website provided on the screen or by calling the CHCC COVID-19 info line, Monday through Friday from 7:30 a.m. to 8 p.m. Reporting for KSPN, I'm Ashley McDowell. The medical care and treatment site at the upper parking level of CHCC is complete. The Medical Care and Treatment Site, or MCATS, is complete at the Commonwealth Healthcare Corporation.
Today we have an opening for the medical care and treatment facility. Do we want to use it? Absolutely not. But we wanted to make sure that in case we need it, that it's here, readily available.
MCATS consists of 6 tents and 40 hospital beds that will be used as a backup COVID-19 site for CHCC, shall the numbers exceed the hospital's capacity.
CHCC in the beginning was trying to make sure that we have a separation of the COVID and non-COVID patients. It's been difficult because of our current facility, how it was made. And when we went to the governor and said, we really need this facility to be up and running simply because of, what is the possibility? What is the possibility of having more patients here? We are 76 bed capacity, and we want to make sure that we are able to be prepared. This facility will kind of help out in also making sure that our population is taken care of. As you know, CHCC has been the safety net for a lot of people for healthcare treatment, and we want to be able to make sure that there is that service that continues on. This last few days, it's not COVID that's been dying. It's the people that have been dying have chronic diseases that we need to take care of as well. So we want to make sure that we bring back these services and really at full strength. So this is a cooperation to ensure that our population is taken care of, whether COVID or non-COVID. That's basically what we're trying to do here.
Kanoa Resort will be the COVID-19 alternative care site that will have 50 hospital beds and is expected to be completed by mid-May. More supplies have arrived into the CNMI for COVID-19 response. Take a listen. Over the last week, the CNMI has received 40,000 of the 60,000 test kits that were purchased from South Korea. Also chartered in were 70 ventilators, medical equipment, and thousands of personal protective equipment, such as masks, gloves, isolation gowns, face shields, and hazmat suits, according to Governor Ralph Torres.
Just understanding the challenges that the U.S. is facing, the challenges of not having proper or enough PPEs for first responders, just accepting that at no one's fault. I'm not here to blame FEMA or anyone. Just the reality is we're all fighting for the same masks, we're all fighting for the same ventilators, we're all fighting for the same supplies and equipment. So what we did is we looked at on our side of the world and making sure that we're ahead of the game by ordering our ventilators. I mean, we had issues on ventilators alone, understanding again how many ventilators is needed in the U.S., that even one or two more here in CNMI will help tremendously. But we went beyond that, prioritizing the orders have to be made a month ago, and even we still have more ventilators that we're having a hard time bringing it here. But I guess through the collaboration with FEMA, again, we've been through this disaster for, 4 disasters now. Just did the background and to go outside the norm practice. And we purchased this PPEs, ventilators, supplies. And we also chartered the flights, cargo flights, on our own to GAR and of course our partners, CTSI and other partners, working hard in bringing those PPEs, equipment, lab supplies, test kits.
The CNMI paid for these supplies up front and will be reimbursed by FEMA.
When the president declares an emergency, part of that is identifying a cost share for the expenses. Sometimes FEMA will make direct purchases, which you've seen with like the air bridge and purchasing items directly and delivering it to states and Commonwealth. With this particular situation, the Commonwealth has been very efficient in making those purchases, and in making them, they then submit that expense, oftentimes while they're making the expense, or incurring the expense, and FEMA reimburses on a cost share. The current cost share right now nationwide is 75-25, which means the federal government automatically places 25% of the reimbursement in place. And then that cost share on occasion will change based on the needs of that particular entity, that state or that Commonwealth, their financial situation, and how significant the impact was.
Governor Torres says more COVID-19 response supplies will be delivered this week, all in preparation for the future challenges.
We have more coming. We have a whole shipment coming in Wednesday, another shipment Thursday, and then another shipment next week. I'm confident that that our PPEs will be enough for our nurses, our first responders, doctors, but we want more. Our challenges, again, we find other countries are stopping exports because they know that how critical to protect their people and their country, and they're ceasing exporting PPEs. And that's why we're doing everything we can, that even if they lock down, we still have enough for our folks here. Coming up, a bill to increase bond anticipation notes has passed the House and Senate. More after the break.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. Hi, my love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Winigi PHI Pharmacy in Gofadahi, Ihinim Lomo.
Our complete line of pharmaceuticals and lowest prices ensure you get the treatment that you deserve. Our compassionate, friendly, multilingual staff will take the time to get to know you, explain your medications to you, and answer any questions that you may have.
Ngere eyor sumaye ukalweres ren, kutsu wayor safeye emal ebalusyu klalyam weres.
Inumin ang inyong gamot ayon sa nireseta ng inyong doktor at alinsunod sa bilin ng inyong parmasutiko.
We accept most insurance, but in case you don't have coverage, we offer cost-effective generic drugs.
PHI Pharmacy, your lifelong partner in health. PHI, the pharmacy you can trust.
Mom, are you sure? What about the shutters? And do you have your medicine?
Don't worry about us, love, okay? You take good care of yourself. I'm in love. Yeah, sorry. The power went out, so I had to light up all the candles. Yeah. Yes, baby, yeah. I'm just glad our home phone's working and we're able to contact you.
Welcome back to the Channel 2 News. Legislation to increase the bond anticipation notes for another 10 years passes the House and the Senate. Sally Lemus reports.
Authored by Representative Ralph Yumel, the intent of House Bill 21-111 is to provide the Commonwealth Development Authority with more flexibility when issuing general obligation bonds or pension obligation bonds by extending the maturity of bond anticipation notes from 5 years to 15 years. Currently, CDA is allowed to issue obligation bonds up to $300 million, and this bill further amends the languages.
Currently, the law is too broad, which they can still do it, but the most important part here is the 5 to 15 years, and I believe the clarity of the note or bank credit or other instrument.
Bond anticipation notes cover notes, loans, lines of credit, and other instruments of indebtedness. Finance Secretary David Atalik says as the government works tirelessly in finding money for the settlement fund while also clearing obligations through the bond negotiations and interested investors, they are finding that the interest rate being asked is quite high.
In the meantime, we have not accepted the terms, and then therefore we look for other financial opportunities that can help us with the settlement fund. In this case, the bill will allow a CDA to enter into an agreement with any lending or banking institution. In the meantime, as we get and work on a pension obligation, current law only allows them to have a 5-year maturity. So if we were to borrow $1 million, we need to pay it back in 5 years. Whereas we were anticipating a pension obligation bond to go in a duration of 15 years. So, you know, can you imagine the monthly payments, or I would say the annual payments of the amount that you borrow and have to pay it off in 5 years versus 15 years could be a very substantial amount due to the lending institution. So we asked the legislature if they could please look at the law, amend it to increase to 15 years, which will allow us to as any value or any amount that CDA borrows in anticipation of the pensions obligation bond will not be a large impact to our coffers to repay in 5 years that we can repay in 15 years. Now, let's keep in mind that that law allows us basically within 15 years, we need to close a pension obligation bond to repay that loan. And that gives us the time to do so, which we have the authority and the authorization by the legislature to go into public debt for pension obligation and then for the settlement fund only.
The bill was unanimously passed in both the House and Senate. Reporting for KSPN News, I'm Sally Lemus.
On Guam, individuals are getting screened in certain areas, getting a pass to get tested for COVID-19. KUAM reports.
Half-a-day CNMI, here's your Guam news update. Nurses from Public Health continue their canvassing in the Estumbo area of Derido to pre-screen individuals for their pilot community testing project getting underway this weekend. Sabrina Salas-Matanani has more.
A new trajectory and a new mission to search and destroy COVID.
Instead of them coming to our doctors or our clinics, we go out and find them and reach out to them.
Leading the charge, Public Health Director Linda N. Pinco Denorsi, who says over the past 2 days they've been gathering their intel in preparation to test at least 100 residents.
I have the opportunity to visit them because we did a walkthrough yesterday with all our collaborating partners, federal, local, and private.
Since Thursday, public health nurses have been pre-screening residents in Sagan Lanadzen and Lower Estumbo. Those with mild COVID-19 symptoms were given passes for testing on Saturday from 9 a.m. to 12 noon at the Estumbo gym. According to Public Health's dashboard, there are a total of 42 confirmed COVID cases in Derido, with 37 released to isolation. Out of the total 140 confirmed cases, as of today, 47% are Chamorro, 40% Filipino, while almost 13% is from other ethnic backgrounds. Denorsi says Derido makes for an ideal location to start community testing.
As you know, Derido is a very densely populated village, and so we know that the ethnic distribution of that area is really diverse. So it's not just Chamorros, we also have FSM, we have Filipinos, we have practically every ethnic representation. And so what we want to do is we want to hit those areas.
Saturday's testing is on a voluntary basis. Additionally, residents who are bedridden or disabled, Public Health will test them at home. Residents must wear a mask in the drive-thru or walk-in lines. The goal is to test as many people as possible to determine how widespread COVID might be in the community. Saturday's pilot project is only for residents around Estumbo. However, if you are experiencing symptoms related to COVID, you're urged to immediately contact your private physician. If you don't have one, you're urged to call Public Health's regional health centers to get tested. Reporting for Guam's News Network, I'm Sabrina Salas-Matanani.
And for more Guam News headlines, check us out on Facebook at KUAM News.
Coming up after the break is your KSPN2 weather report.
Green sea turtles and hawksbill turtles call the Mariana Islands home. They are an important part of the marine ecosystem. They are under threat, and they are protected under CNMI law. Keep plastic out of the ocean. Keep vehicles off the beach. Use the Sea Turtle Stranding Hotline if you see poaching activities or if you see a turtle in trouble. Call 287-8537 and save a turtle.
My family is on whole home Wi-Fi powered by Plume.
Since we installed the Docomo whole home Wi-Fi, what did you guys notice about it?
When you pull up the driveway, it automatically connects, and I don't have to get out of the car right away and come upstairs to go on my phone.
My favorite thing is that it doesn't buffer when I'm watching YouTube.
My favorite thing is that when Addie calls now, there's no lag. Like before, it used to be where I couldn't see her sometimes and I have to hang up and then call her back, and now I don't have to do that.
You know what's a good thing too is that when you come over to visit, I could give you your own password. I can assign a time limit so that I can say that you can only be on it for 1 hour, so that means you won't get in trouble from your mom.
And then you can go home.
The thing that I love the most is that I can freeze the internet for periods of time so that we can enjoy dinner time like this. Why are you rolling your eyes? So I'll turn it back on after dinner.
Whole home Wi-Fi powered by Plume. Docomo Pacific, better together.
And And here is your weather report. Today we had a high of 90, a low of 80, 62% humidity. Tomorrow partly cloudy with isolated light showers. East winds 10 to 20 miles per hour. Tomorrow we'll have a high of 90, a low of 77. Seas 5 to 7 feet. High tide at 9:25 a.m., low tide at 5:16 p.m. Sunrise is at 5:55 a.m. and sunset is at 6:34 p.m. Thank you for tuning in to KSPN2 News. Have a great and safe rest of your evening.